International workshop on Waldenstrom macroglobulinemia held in October 2004 in Paris. 57 investigators representing 13 countries took part in the workshop, and at that time it was the most comprehensive and largest meeting on Waldenstrom macroglobulinemia. But what was the most important message that came out from these workshops? I would remind that in the WHO 2004 classification, the identification of WM as a specific entity remained controversial, and we have had several reports that address this issue, and further results were expected. Of course, today, the high incidence of MID88 mutations in WM patients definitely address this issue. These pathological discussions favored several studies on the interaction between the immunological microenvironment and the growth and survival of tumoral cells. Thus, we have had some presentation on the role of VEGF, BLIS, CD40 ligands, and mast cells reported during the session chaired by Jean-Claude Brouet, a guy who previously reported also the role of interleukin-6. Several presentations of our Spanish colleagues and from the Mayo also reported for the first time the clinical characteristics associated with the 6q deletion, a characteristic now well identified as associated with inflammatory markers and the need of therapy.
Regarding the treatment session, many communications were presented on the impact of purine analogs used as a single agent or in combination with cyclophosphamide or rituximab. Rituximab-fludarabine combinations was tested in the first international collaboration with US and European teams. Of note, this combination is still used in first line with the bendamustine rituximab combination in many countries 20 years later. There were also the presentations of the design of the WM-1 trial, which was the first randomized international largest trial in first line, published later in 2013, with the inclusion of 339 patients. At least Steve Treon reported the outcome of the first 8 patients treated with the proteasome inhibitor Velcade.
So, in addition, the workshop of Paris was also a major step for the project of the International Prognostic Index for Symptomatic Waldenstrom Macroglobulinemia. This is a great project held with Gianpaolo, and in Paris, all of us accepted the now well-recognized specificity of prognostication in Waldenstrom macroglobulinemia patients. Indeed, Waldenstrom macroglobulinemia is the only malignancy with prognostic tools specifically designed according to the clinical concern of the patient, is it symptomatic or not. Now, as wished and expected by the authors, this study serves as a backbone for further improvement with new proposals for both subgroups of patients. I would like also to point out a report made by Steve on the prognostic role of response at the end of chemoimmunotherapy during the therapy session of the Paris meeting. Now, dynamic prognostication is indeed a major and tricky issue that could be addressed by recent and future large international prospective trials, once again through collaborative studies.
Highlights of the third international workshop included a celebration honoring the lifetime contributions of 3 individuals whose tireless efforts helped define our understanding of Waldenstrom macroglobulinemia. Dr. Robert Kyle, Dr. Maxine Seligman, and Dr. Marvin Stone were honored at the opening ceremonies with Lifetime Achievement Awards. Furthermore, Robert Kyle's birthday was celebrated on the boat fly on the Seine. Finally, the closing ceremony features lecture by Dr. Anders Waldenstrom, honoring the personal and academic life of his father, Dr. Jan Waldenstrom, and a lecture by Jacques-Louis Binet.
Finally, a workshop is like a step, but this is not only a scientific program. Indeed, for a great jump, the step needs to be relaxed and comfortable. In Paris, it was a privilege to take part in the organization of the workshop with Veronique, Jean-Paul Fermand, Steve, the support of IWMF, and importantly, patients. With a lot of enthusiasm, all this team provided many suggestions. The meeting location was very, very close to the Eiffel Towers. The closing ceremony held in an impressive rooftop restaurant over the Théâtre des Champs-Élysées, the place where 90 years before was created the Sacre du Printemps. Indeed, an incentive to creativity and discoveries.
To conclude, the rare disease is the most exciting blood disorder regarding the clinical manifestations related to IgM, needing a close collaboration with other physicians, neurologists, internists, nephrologists, and large collaboration is the clue of the success. We need young clinicians and researchers to continue to feed future workshops and to advance our knowledge through their enthusiasm and work. Thank you.